Good evening. My name is Edward Miles, and along with my colleague, Kaylee Braddock, we would like to discuss heart failure and disparities and give you a visual representation. Heart disease is the leading cause of death in the United States. Even though as a society, the National Center for Health Statistics, there are over 24 million deaths from heart disease between the years of 1999 and 2017. Our overarching question was, does risk for hospitalization for heart failure increase depending on a person's demographic group? An additional question that we had was, are there differences in heart failure hospitalizations when it comes to race? When looking at one data set from a healthcare organization, it was found that 60.77% of heart failure admissions were people of Black or African American descent, compared to 36.98% white or 1.93% for Asians. And it was additional 0.16% from Hispanics and American Indians. The Black-white disparity in heart disease death showed an increase of 16.3% from 1968 to 2015. Despite increasing access to care, lifestyle modification, heart disease and admissions from heart failure have shown to continually adversely affect our underserved populations. Another question that we had was there a difference in heart failure hospital admissions when it came to gender? When it came to gender and its role in the risk of heart disease, in a study of 2017, overall death rates from cardiac disease was 134% higher among men than women. When reviewing our local data set, in fact, out of 623 patients, 349 were male and 274 were female. This confirms the initial research that males are at a higher risk and have an increased number of hospitalization when it comes to heart failure. As we continue to review these groups and look for potential disparities within our underserved communities, we also want to know, insurance-wise, which ones were highly utilized by patients admitted to the hospital for heart failure. From our studies, and according to CASA and Mark 2013, heart failure is the most common indication of hospitalization among those who have Medicare, with an estimated 1 million heart failure hospitalizations per year. Medicare and Medicaid were the most common insurances found in patients who have been admitted with heart failure in this data set. In addition, the largest insurers in this data set were Medicare Advantage, Medicare, Medicaid, and Cigna Medicare. And 466 out of 623 patients had one of the four insurances. By looking at this data from both a national and local perspective, our group concluded that Black or African American males are at the highest risk for hospital admissions due to heart failure. Of those admitted for heart failure, the patient is most likely to have either Medicare or Medicaid. In conclusion, we hope that this data and this research that we have done can be utilized to better deploy our resources into those communities that are adversely affected when it comes to heart failure. At this time, I'd like to open up the floor for any questions that